So I have just entered into my patient's room. I have let them know who I am. I have verified with them their name and their date of birth, along with their wristband. I have washed my hands when entering the patient's room and closed any curtains and any doors to maintain privacy. I'm going to come in and talk to my patient, explain what I'm doing here today, what the procedure is, let her know that we are doing a straight catheterization because she needs to, her bladder is full. We need to get rid of all that urine. We don't want any UTIs, anything like that. So I would have the patient, after explaining the procedure, making sure that she's comfortable and doesn't have any questions. For the female, I'm going to place her in the recumbent position. We're going to lay the bed flat, and once I have done that, I will be exposing the patient. I'm putting on clean gloves, so I'm just going to pull this back, raise her Johnny, and I've put on clean gloves. At this point, before I put on the clean gloves and we're cleaning her, I also made sure to have a trash can within reach, and as well as a light if need be. So at this point, I have donned clean gloves. I am coming over. We're going to clean the perineal area with warm water and soap. I will pat dry, and once I've done that, I'll remove those gloves, go over and wash my hands again. I have collected supplies, and in between this, I would offer to drape the patient just for her comfort and for her to feel, more privacy if she needed it. I would come over to my kit, and I would open the package. Everything inside is sterile, so I need to make sure to maintain that sterility. But I open away from me and then both sides. And at this point, I'm going to want to put a drape down in between the patient's legs to keep that area as sterile and clean as we can. So I would take my first top drape, only touching the outer 1-inch border. Then I'm going to come over and grab my fenestrated drape to put over the area that we're working on. Touching only the outer 1-inch border again. This is going to go down over the vagina. Once I have draped her, I'm going to put on my sterile gloves. Now that I have my sterile gloves on, I'm going to bring my I'm going to remove the stuff that I don't need first from my container. I don't need the cup right now, and I don't need the saline. I'm going to bring my container over in my working area and place it between the patient's legs. I'm going to get my lube ready for the catheter, and as well as the iodine swabs so I can clean the area firsthand. At this point, I'm going to retract the labia so I can see where I'm working and what I need to locate. So once I've done that, this hand is no longer sterile. I have my sterile dominant hand. So at this point, I'm going to take swabs and make sure to clean the vagina. The first swab, I'm going to clean away the furthest part from me. So I would swab the left side top to bottom once and get rid of that. I would then swab the part closest to me from top to bottom, and then I would do one more swab down the middle, top to bottom, and dispose of that as well. Once I have done so, and I have my lubrication ready, I'm going to lubricate the top of the tip of the catheter, but I'm going to remove this first because I don't need it covering here. So I have all my lube. I have lubricated the catheter. I have my basin that I'm going to be letting the urine flow into. I have lubricated 1 to 2 inches of the catheter for a female. If it were a male patient, it would be 5 to 7 inches of the catheter that would be lubricated. I'm going to, so with the female, if you feel any resistance when you're inserting the catheter, make sure you can gently twist it to advance it. We're not going to force anything. If the labia happens to fall back onto the catheter, we have then lost sterility, so we would have to start over again. If the catheter itself touches the patient's leg or any clothing or anything like that, we have also lost sterility and we'll have to start over. But once we have started, we're going to insert the catheter, start to insert, and we will insert 2 to 3 inches with an additional 1 to 2 inches. And once all the urine is done draining out of the catheter and the void is complete, we will remove the catheter and the container with the urine in it. We're going to just put it over here in case we need a urinalysis or anything like that. We can collect from our sample. At this point, I'm going to make sure that the patient is clean. I'm going to make sure that she's dry everywhere. She's not wet or anything underneath her. We would make sure that the area is clean. There's no urine anywhere. I would remove my draping and my gloves, make sure the patient is comfortable. At this also, I did forget to mention when inserting the catheter, we would ask the patient to bear down and also take a couple nice deep breaths in and out. We would also do the same thing and ask a male patient to bear down as well. But I would clean up my area, make sure the patient is comfortable, raise the head of the bed up, give her the call bell, make sure she doesn't have any questions. I would then document my findings. Also with a male patient, I did mention that we would lubricate 5 to 7 inches of the catheter. We would insert the catheter 7 to 9 inches with an additional 1 to 2 inches. We would also, with the patient who is a male, we would hold the penis at a 90-degree angle. If they were uncircumcised, we would hold the foreskin back so we could have a clear view. We would also make sure that the area was clean with soap and water beforehand. And when swabbing and making sure that the penis is clean, we start at the meatus and work in a circular rotation outward. And same thing, we would ask that patient to bear down as if to void. And once the urine was emptied and the patient was comfortable and he felt good, then we would clean him up as well, give him his call bell, cover him, make sure he feels comfortable and that he doesn't have any questions, and then I would go and document my findings.